Hello. According to National Institute of Health, the prevalence of drug-drug interaction ranges from 0.8% to 90.6% among older dwelling community individuals. That is to say, this incidence not only accounts for orthodox medication use but can as well affect the use of herbal medicines. So this leads me to the topic of today's discussion, herbal drug interaction. During the course of this presentation, my team and I will be talking on herbal drug interaction, mechanism of this interaction, some common herbs and potential side effects, assessing the possibility of taking this combined agent and clinical implication of this herbal drug interaction.
Now, what is drug-herbal interaction? Drug-herbal interaction refers to the possibility that a herbal constituent may interfere or alter the pharmacological effect of a conventional drug when given concurrently or vice versa. Examples of this drug-herbal interaction, we have St. John's wort interacting with immunodepressants such as serotonin reuptake inhibitors. Here, it potentially decreases the effect of this class of drug. We have ginseng interacting with diabetes medication. Here, it leads to changes in blood sugar levels. We have ginkgo biloba interacting with warfarin, a blood thinner. It leads to risk of bleeding. We have echinacea interacting with immunosuppressants. It leads to reduction in the effectiveness of this drug.
Taking over from my colleague, I would like to talk about the mechanism of drug-herbal interactions. Drug-herbal interactions have several mechanisms such as enzyme inhibition, receptor binding, cytochrome P450 interactions, P-glycoprotein interactions. While there are so many herbal drug interaction mechanisms, the main herbal drug interaction mechanisms can be broadly classified into two. We have the pharmacokinetic interaction and the pharmacodynamic interaction. Pharmacokinetic interaction refers to the action of herbal drugs on the half-life, volume of distribution, and clearance of orthodox medicine. And some of these interactions include absorption. Under absorption, we have altered gastrointestinal pH. Under distribution, we have protein binding. Under metabolism, we have enzyme induction and enzyme inhibition. Under excretion, we have kidney function. Then for pharmacodynamic interactions refer to the action of herbal drugs on receptor binding sites of orthodox medicine. And some of these interactions include additive interactions, synergistic interactions, antagonistic interactions, allosteric interactions.
Okay, let us look at the probability or chances of combining these agents or taking these combined agents. Look at the prevalent use of herbal supplements, polypharmacy, lack of awareness. In US, about 15 to 20% of the adults make use of herbal drugs, which could lead to this herbal drug interaction. And then, in terms of polypharmacy means multiple medication. In adults, they tend to take more drugs, which could also lead to multiple medication and then herbal drug interaction. The lack of awareness. Some patients are not aware of the potential interaction between their medication and herbal supplements, and as such, it could lead to drug-herbal interaction.
Taking up from where my colleague stopped, I'll be talking on clinical application of herbal drug interaction. Clinical application of herbal drug interaction varies significantly depending on the drug, herbs and drug involved. So some of the clinical implications of herbal drug interaction, we have the altered drug metabolism, increased toxicity, reduced efficacy, increase in toxicity of drugs. Some herbal supplements can increase toxicity of drug. Example is combination of ginkgo biloba with an anticoagulant, such as warfarin, will increase the risk of bleeding due to the active effects of the anticoagulant. So, talking on pharmacodynamic interaction, this occurs when the herbal drug have similar or opposing effects with the drug. Example is a sedative drug, which is valerian herb, combined with CNS antidepressant drug will lead to excessive sedation.
So, in conclusion, it is crucial in drug research to investigate the effectiveness and adverse effect of herbal drug products. This will help investigate the active compounds in medicinal plants, and contaminations in poisonous plants and herbal mixtures. Thank you.